Greetings and welcome to week 2. Our focus is on the Affordable Health Care Act and its influence on health care. Healthcare reform in America began around 1798. Since then, several presidential administrations have sought to improve health care and how it is delivered within the United States of America. The first president to attempt health reform was President Theodore Roosevelt. President Roosevelt's Bull Moose campaign rallied to enhance how American citizens paid for health care services. The wealthy paid out of pocket and received much of their care in the comfort of their home. The unwealthy either used home remedies or did not seek health care at all. Health insurance was unheard of during this time. After President Theodore's attempt failed, the next president, President Franklin Roosevelt, he took a shot at health reform. He sought Congress approval of national health insurance, but that was unsuccessful, and he actually passed away before any other acts could be implemented. Thus, the tax was passed on to President Harry Truman. Another milestone was with President Clinton and the Clinton administration, who implemented the Task Force on National Health Reform during the early 1990s. Nevertheless, the plan did not make it past Congress, so later he implemented the Health Security Act, which also did not stand the test of time. Currently, President Obama and his administration has been the most successful with health reform for all all American citizens and legal citizens within the United States via the enactment of the Affordable Health Care Act of 2010. This act was signed into law in March of 2010. It consists of 2 bills that affect the delivery and funding of health care, requires the cooperation of federal and state government and the healthcare system, and it has already created deep changes within healthcare and is expected to continue such trend over the next few years. Primary emphasis of the ACA addresses issues such as health coverage, quality, effectiveness and efficiency, public health, disease prevention, and revenue. However, its main focus is to increase access, improve quality, and lower overall healthcare costs. The ACA requires a lot of collaboration with state and federal governments, insurance companies, providers, and other stakeholders to address the issue of access to health care. It requires individual mandates, it expands Medicaid, provides health benefit exchanges, and guarantees certain health care coverage. Specifically for young adults, it maintains your coverage under your parents' health care insurance up through the age of 26. As previously mentioned, the Act focuses on quality and efficiency. There are many incentives for providers who elect to enroll in accountable care organizations for the sake of providing quality initiatives to Medicare patients. The Act also includes population health and the well-being of the community, as well promotes prevention and wellness among all consumers. As with anything, there are always challenges. The ACA has endured many challenges, however, there are numerous challenges that still lie ahead. But what are some of these challenges? I'm glad you asked. From the Supreme Court level, the limitations with withholding Medicaid funds is if states do not wish to comply with the Medicaid expansion component. It's huge. The Act also continues to just face numerous of other challenges in Congress and the courts, amongst other legislation. At the state level, state sovereignty is an issue and concern. Financial and other health resources remains a concern. And social justice, as it may cause issues for states when constituents disagree on exactly what is just. Now, let's now take a closer look at the impact of ACA on a more micro level in healthcare, with an emphasis on hospitals. Many hospitals face issues related to cost, quality, and access while implementing the requirements of ACA. Smaller rural hospitals face the challenges of not even being able to afford to meet the mandates of the ACA 2010 requirements in regards to meaningful use and other forms of implementation of electronic health records. The ability to achieve goals of patient-centered care and fiscal responsibility remains a high priority and concern for health administrators. Additionally, hospital administrators struggle with balancing social justice with market justice amidst a time of great change. Drilling things a little further, physicians are concerned about practice implications of ACA 2010, which may potentially change the way that they practice, thus reducing their overall autonomy. Furthermore, there is a shift in the number of physicians, hospitals, and other healthcare providers who voluntarily enroll in accountable care organizations known as ACOs and provide quality care to Medicare patients. Additionally, there is becoming an influx of physicians who promote the practice of preventative and integrative medicine, or better known as alternative complementary medicine, CAM. It is forecast that the future of healthcare may no longer place physicians at the center or at the forefront of healthcare. More and more healthcare entities are adopting a more patient-centered approach as a means to enhance access, quality, and reduce cost. From an ethical perspective, from the public view, if healthcare is a basic human right, then the ACA 2010 works towards increasing that right. Some may question whether it does, and some may question whether it does not. However, based on the ethic principles, Rawls' idea of social justice is consistent with ACA. Mill's theory of utilitarianism can be used as an ethics basis, but ACA has been known to violate various parts of market justice. Regardless of the pros and cons of ACA 2010, as with anything, there are always limitations. Let's take a look at the limitations from a public perspective. First, there are still groups who are not covered under the ACA. A question that I pose to you is, what would Kant say with respect to his belief regarding categorical imperative? Remember, according to Kant, categorical imperative refers to a method of testing one's actions, thus understanding how to determine what is good in efforts to assist one to make moral decisions. Another limitation and ethical concern aligns with Mill's perspective of utilitarianism. Would Mill find it ethical to provide better access to health care for some people or for some citizens, but not others? That said, everyone still do not have access to health care. Another public limitation revolves around the concept of social justice. At the end of the day, who eventually pays for uncompensated care? Hospitals and other healthcare entities must still find ways to provide care for those who are uninsured and still pay for care provided. This is an ongoing limitation and challenge for health administrators of all disciplines. The next couple of slides provide an overview of how ACA 2010 may align with each ethical principle and identifies a few limitations associated with each. The first principle is autonomy. ACA 2010 seeks to advance self-rule or autonomy for some Americans. However, benefit exchanges and the individual mandates may limit such autonomy. ACA 2010 may also be viewed as increasing the beneficence, and non-maleficence. However, it is not benevolent for the uninsured. Justice is a key principle for ACA 2010. Distributed justice is better met because access to care is improved. ACA also addresses distributed justice issues beyond patient care. Nevertheless, ACA is not always viewed as just in respect to market justice. Raw social theory fits because access to health care is viewed as a basic right. However, the individual mandate encourages the healthy to protect those in a lesser position. The individual mandate also passes the categorical imperative test, meaning that it is a duty. Mill's idea of utilitarianism could be used to support the individual mandate. However, the individual mandate has ethics limitations, and not all Americans benefit from it. The individual mandate, while necessary for funding, remains controversial for many Americans. This mandate requires U.S. citizens to have health care insurance unless they qualify for an exception. If someone chooses not to be insured, he or she could be fined. Some may find this mandate a violation of autonomy, whereas others may find it a violation of justice, and some may find it a violation of both. What do you define it as? Despite the pros and cons of ACA 2010, what does it mean for its future? ACA is known to may serve as a means of reshaping the entire healthcare market as a whole. It may serve as the foundation for universal health care. Population health is expected to increase with an emphasis on prevention and wellness. It may lead to a reduction in employer-based healthcare insurance. And ACA just may transform how medical education is delivered. It will continue to create many ethical challenges, and it will require administrators such as yourself and future administrators to be able to apply ethics and balance resource utilization. As future healthcare administrators and our current administrators, if you're already practicing, you have the responsibility of making change happen efficiently and effectively. You must be active in your healthcare organization and keep abreast of current healthcare reform issues. It is also your responsibility to make sure that all of your staff at all levels are aware of all changes and are abreast of the changes, thus implement these changes to make sure that your outcome and overall productivity is in alignment and in compliance with the various mandates and rules, regulations, etc. And lastly, you must make sure that all of your policies and procedures are updated and implemented well. Let's now divert our attention to Chapter 6, which is entitled Market Forces and Ethics. To begin, let's define market forces. What are market forces? Well, I'm glad you asked, because that's a good question. Market forces may be defined as anything that has a direct or indirect impact on the means in which healthcare services are delivered and are administered to consumers. Market forces exist outside of healthcare organizations, but these have a significant effect on healthcare organizations. Because the potential market is so large, healthcare administrators need to understand the influence of market forces on the industry as well as on their healthcare organization. Examples of market forces may include, but is not limited to, changes in the economy. For example, unemployment. Unemployment has an effect on healthcare utilization. If you're working and making money or have insurance through your employer, you will be more likely to seek health care. If you are not working, you're unemployed and on a strict budget and just in a position where you cannot afford it, the probability of you going to the doctor is slim. You will only go if you just had to, and in many cases that is in the form of an emergency. Changes in technology and just the overall cost of health care continues to be an issue and are huge market forces that has an impact on health care and its delivery. However, the primary focuses in which are tech emphasized and which we will look at in greater detail are the market forces of managed care, the aging of the baby boomers, and integrated medicine. Let's take a look at managed care and the ethics behind that. Managed care has been a part of healthcare for many years. It has some success through controlling access and pricing. It is definitely a highly competitive business. Managed care uses utilization reviews and practice profiling to control abuse and regulate practice patterns. State and federal guidelines control managed care practices. From an ethical perspective, there are patient autonomy issues and issues related to physician incentives and conflicts of interest, and even some concern around informed consent and complete disclosure of covered and non-covered services. Let's now take a look at the baby boomer population. In regards to this population, aging baby boomers represent a significant healthcare market force. As they age, the baby boomer generation changes the how, the where, and the when healthcare services are administered. This generation is more knowledgeable of healthcare products and services, more politically active, they're living longer and desire independent living. They are more conscientious of their health issues and take an active role in their treatment of health care. Surprisingly, more of them tend to consume more prescription meds than previous generations. And they also have higher instances of overweight and obesity. So exactly what does this mean for health care? Well, health care must figure out and implement strategic ways on how to treat the needs and the demands of the baby boomers while maintaining a profit margin and meeting their expectations. To combat many of these problems, the use of integrative medicine has become and is becoming more and more popular. According to the National Centers for Complementary and Alternative Medicine, if a non-mainstream practice is used together with conventional medicine, that form of approach is known as complementary. If a non-mainstream practice is used in place of conventional medicine, it is considered alternative, such as your herbs, the use of holistic medicine, if you will, the herbs and other types of holistic measures of treatment. I actually provide, I actually list two types of complementary approaches in treating your healthcare symptoms, if you will. They are known as natural products and mind and body practices. Examples of natural products may include organic herbs, vitamins, noni juice, cinnamon, honey, chamomile, and ginseng. Examples of other mind and body practices, in addition to Pilates, yoga, and Tai Chi, include massages, aromatherapy, guided imagery, meditation, and acupuncture. You may ask yourself, why is there an increase in this type of medicine? Well, first of all, consumers desire to have more voice in their care. You have more consumers who desire to take less meds in some instances than taking a lot of meds. However, on the opposing side, many of the baby boomers feel that if they go to a doctor and do not receive a prescription and getting type of pills, that they're not receiving quality care. So I guess it depends all in who you talk to. Also, you have the National Institute of Health Research. They are beginning to expand in this aspect. The physician desk reference is beginning to include herbs as a form of treatment, and primary care physicians and specialists are referring patients to IM practitioners. Such treatment is offered at cancer, pain management, and other centers, and surprisingly, some insurance companies are even beginning to cover this type of practice. IM may be part of numerous healthcare businesses in the future versus a select few in today's health system. The ACA may increase the use of IM as part of population health with emphasis on community and prevention and wellness. Consequently, it is imperative that you, as healthcare administrators, hire competent practitioners to practice ethics and protect the public and the institution. Information was extracted directly from your textbook, so you see the reference on this slide. And congratulations, you have made it halfway through week 2's lecture. Let's see how much you remember by completing the self-assessment for chapters 5 and 6. Good luck, and remember, if you have any questions for the professor, please send an email. Blessings to all.